Hi everyone, this is Dr. Ryan Edwards with Windermere Dental in Cumming, Georgia. Thanks again for coming back to check out the video. If you do like the video, make sure you hit the like button and subscribe. We post videos here every Monday on all things related to dentistry, and we try to give you tips and tricks to stay happy and healthy and have a good smile. Real quick, so last week there was a lot of confusion here in Georgia as far as when dental offices will be opening. The Georgia governor put out a memorandum, an order, and then had to backtrack and change it. So there's been lots of confusion. I'm going to give an update on our office on Tuesday. I'm recording this Sunday the 26th. I'll be posting it Monday the 27th. But on Tuesday the 28th, which will be tomorrow now from when you're watching this, hopefully. So Tuesday the 28th of April at 11 o'clock on Facebook, I'm going to be doing a Facebook Live. Check it out, 11 in the morning to about 11:30. I'll be answering questions, explaining what the status of our office is. If you have questions, you can show up and type them in the comments section. I'll answer as many questions as I can. If a ton of people show up, I'll stay on for as long as is necessary to answer everybody's questions. So check back 11 o'clock on Tuesday on Facebook. Search for Windermere Dental on Facebook if you don't already follow us there. And we're not the one in Orlando. Make sure you're looking at the one in Cumming, Georgia. So look forward to seeing you there. Today's topic is halitosis. Halitosis is bad breath. And lots of people struggle with this, and it's really socially embarrassing. So I'm going to give you some tips on how to kind of manage it. Halitosis, the things that cause bad breath, you can basically split them up into two separate categories. There's the short-term temporary type causes that are non-pathological, and then there's your more chronic bad breath issues, which are more pathological. Let's talk about the temporary category real fast. So these are essentially caused by things that go in your mouth that smell bad. If you eat foods or drink something that smells bad, it's going to give you bad breath. The most commonly known ones are garlic, onion, coffee, even kombucha and curry are all foods known to give you bad breath. I didn't know what kombucha was. I had to look that one up. It's a tea. I don't drink a lot of tea, so that's why I didn't know what it was. But yeah, anything like that you stick in your mouth will cause bad breath. It's usually temporary. You can chew some sugar-free chewing gum after you eat it to freshen your breath. Have a mint, Listerine strip, something like that. Also, smoking, vaping, chewing tobacco, all of those will contribute to bad breath as well. Clearly, the more you do it, the longer your breath will stay bad and the more difficult it may be to freshen it up. Finally, there are some prescription drugs which are known to contribute to bad breath, so check the label or the information packet that comes with your medication, or if you notice it's a chronic problem, if it becomes really bad, talk to your physician and see if there's an alternative to taking it. Finally, there's something that fits in this category, which is not something you put in your mouth, but it is a temporary condition, and that's when you have morning breath. Morning breath happens because during the nighttime while you're asleep, your body produces less saliva. Less saliva means you have less fluid washing away the bad smelling compounds and the bad bacteria. And so when you wake up in the morning, you're not so fresh. It's a temporary condition, is not associated with pathology or disease, and just brush your teeth and floss in the morning and that'll make a big improvement. Okay, now we'll move on to the other category of chronic problems, more pathological driven problems. Most of these, the large majority of these, are caused by a bacteria in your mouth which is out of balance with everything else and it's producing bad smelling compounds. Now these are volatile organic compounds, and a subcategory of them is volatile sulfur containing compounds. The more something has sulfur in it, the more it's going to smell bad. If you think about rotten eggs smell bad because they have sulfur compounds in them. Same kind of thing. So if you get bacteria in your mouth cranking out these sulfur compounds, you're going to be more prone to having bad breath. So what would cause that? Cavities and gum disease definitely are top of the list. Even having food stuck in your teeth and causing gingivitis can be an issue like that. Having a coated tongue, having a slime on your tongue that you're not cleaning off well, will become a breeding ground for this bacteria. So in addition to your regular brushing and flossing, it's advisable to clean your tongue. Some people will just brush their tongue, and that helps, but all you're really doing is sloshing that goop around. The best way to get that stuff off your tongue is with a tongue scraper. There are a few different styles out there. Personally, I like the one that you can it's a long one, you can bend into a horseshoe shape and then use that to scrape your tongue. To me, it doesn't gag me as much. Try the different ones out there, see what you like. Okay, so other common problems for bad breath that are related to excessive bacteria would be any upper respiratory problems. Postnasal drip, upper respiratory infections, things of that nature. Also, you can get something called tonsil stones. Tonsiliths are the medical term for them. Some people call them cryptic tonsils. Everybody has grooves and little pits in their tonsils in their throat. And if you have particularly deep grooves, it's easy for food debris to get stuck in there. When that happens, then you get bacteria and fungus growing on it, and it creates like a little stone or a rock stuck in the groove of your tonsils. They can smell bad, they can be really uncomfortable, and the only way to get them out is to physically squish them out of your tonsils. I know it's gross, but the problem is if you try to gargle, when you do the action of gargling, your tongue will close off your throat, cover the tonsils, and prevent the mouthwash from getting to it. So you have to physically remove that stuff from your tonsils. A finger can help, a cotton tip applicator. If you can't get it yourself, talk to an ear, nose, and throat specialist and see if they can help you out with it. I know it's not fun. Part of the joys of being human, right? Oh, real quick, I forgot to mention, if you have dentures, that often can contribute to bad breath, and you really should be cleaning them very often. You should actually take your dentures out every night and clean them with a toothbrush and toothpaste, or even a denture brush, which is stiffer than a regular toothbrush. And at least once a week, you might want to use a denture cleaner. And definitely don't let your dog run around with your denture in its mouth. Aside from that, you can also get wounds in your mouth either from surgery or from trauma or from radiation or chemo treatment for cancer. All those things can cause a mucositis in your mouth, which will create a situation where it's easy for that bacteria to produce the sulfur compounds. If you're going through cancer treatment, a warm saltwater rinse can help. And even if you're recovering from jaw surgery of some type, warm saltwater rinse works great. I would avoid any alcohol-containing mouthwashes. In fact, in general, when you're trying to deal with bad breath, you want to avoid alcohol-containing mouthwashes because the alcohol will dry you out and make it easier for the bad bacteria to multiply. So we covered the big causes of halitosis already. Interestingly enough, gastrointestinal problems can also contribute, especially acid reflux. If you're having issues with that, try an antacid. If you're having severe acid reflux, definitely talk to a physician. Other significant medical problems that can contribute to bad breath, metabolic disorders like diabetes or trimethylaminoria can contribute to the buildup of smelly compounds in your body and also cause bad breath. And also significant liver disease or kidney disease can cause the same problem. So those are all more significant diseases. See your physician if you're suffering from those. Aside from brushing and flossing and cleaning your tongue properly, there are some other products on the market that have been sold to treat halitosis and bad breath. You can try these and see if you like them. Some of the more common and more popular products are those that contain zinc chloride and cetylpyridinium chloride. There have been some promising research on those, but I'm interested to see if there's any good long-term research that comes out in regards to those compounds, because we don't know long-term if it continues to be effective and if it significantly changes the makeup of the microbes in your mouth, and if that's a significant problem at all. But try them, see if you like it. And another common compound you'll see in, I don't want to name products, that's why I'm kind of being very generic in how I talk about these compounds. But if you check the active ingredients, another one that a lot of the products have is chlorine dioxide. That one again has shown some decent promise for being effective in treating bad breath. We're waiting for some better, larger studies that include more people and a more diverse number of people, and then we need some long-term studies to see how it truly affects the makeup of the flora in the mouth long-term. That's it. That's pretty much all the information I have on bad breath for you. There's lots of stuff on Google, but I always encourage everybody, if you start Googling or looking up information on Facebook about a dental or a medical problem, check your sources. Make sure it's not just some Yahoo saying something, especially if they're trying to make money off of a product. Follow up and make sure their research is sound. and that's really the best way to protect yourself. I might do a video down the road at some point on how best to vet scientific information or medical advice that you get online. So good. So I might do that eventually down the road. Hit the like button, hit the subscribe button. I will see anybody on Tuesday on Facebook Live if you have questions about our office. Otherwise, we'll see you back here next Monday with another dental information video. Have a good week.